What do you need to know now about bone density and prevention of things like osteoporosis in order to make sure you are in the best shape in your 50s, in your 60s, and beyond? This is the episode that will cover all of that for you. With expert interview, Dr. Doug Lucas, we cover what age should we start caring about our bone health as women, what tests to ask your doctor for, and simple activities you can implement today that will prevent and reverse bone loss. Let's dive in.
What's up, sister? Welcome back to the Period Whisperer podcast, the show helping perimenopause and menopause women de-stress your body and decode what it's saying to you so you can own your own health, energy, and weight loss again. If you're new, I'm so happy you're here. I'm Bria. I'm your host, a recovering people pleaser and hustle addict turned functional and holistic hormone specialist. Let's lean in and learn what your body is saying to you.
Hey there, sister. Ready for a really interesting conversation all about osteoporosis, osteopenia, how they are connected to our hormones, why we should care about these things. This was an important topic for me. I'm always wanting to know what I need to do now to feel my best, because what we're doing now, whether you're in your 40s or 50s, you're building your next decade's body. And with my mother having some osteoporosis, I knew I was much more prone to it. So I was really excited to have orthopedic surgeon and osteoporosis specialist, Dr. Doug, here on the podcast. He is a double board certified orthopedic surgeon. And he retired from orthopedics to really further his mission to educate the world that osteoporosis is not only preventable, but often reversible. He has done so many amazing things, and he is changing and bringing forth such an incredible message that bone and muscle health are the key to longevity and health span. And in this interview, he really blows my mind a little bit by explaining the connection, how our hormones shifting impacts them, why we need to be caring in our 30s and 40s and 50s about what we're doing. And spoiler alert, he gives some incredible tips that we can focus on. And it's a lot of the stuff that we are already focused on. But you're not going to want to miss this episode, because if you want to feel your best, if you want to have the strength in your body, building strong bones is just as important as building strong muscle, and they're connected, of course. And it's like wrapping your body in armor so that you can live your longest and best life. So listen to this, take your notes, keep focused on the small changes we need to make, and enjoy this amazing interview with the very energetic Dr. Doug. Hey there, sisters. Welcome back to the Period Whisperer podcast. And you are in for a delight today. I think a really interesting topic. I have one of my expert guest interviews on today, Dr. Doug, who, as you heard, is a double board certified orthopedic surgeon and osteoporosis specialist. And today we're really going to talk about bone health and why you should care, how to care. But we'll get into all of the good stuff and what you can do. But welcome, Dr. Doug. I'm so happy that you're here.
Yeah, thank you for having me. I love these topics, so I'm excited about this.
Yeah, and you work with women kind of in this area, right? Like you talk about hormones. This is one of your specialties.
Yeah, absolutely. So right now in our practice, we're focusing almost exclusively on bone health. Hormones are a huge part of that. So we do a lot of hormone conversations, a lot of hormone replacement and optimization. Yeah, it's a big part of what we do.
How did you, and so I always like, let's lay the little groundwork. Like, how did you get here? Because I know you were much more active practicing surgeon. Now you're kind of more targeted in this area. Like, just give us the snapshot of what made you about this.
I'll give you the short version. So I was a practicing orthopedic surgeon and loved that space. And it really worked for me through training. I loved what I was learning how to do. But then in practice, while the surgery was great, and I loved actually doing the surgery, what I found is that really what I was there to do was mostly to clean up the mess of metabolic health, of either poor decision-making or poor advice that resulted in the need for my services. And so while I liked the surgery, I felt what was missing is helping people to understand how to prevent that in the first place. And so I spent some time sort of like trying to figure out like, how can I do that in practice? And then in the end, I realized that if I really want to be able to have the time to talk to patients, I need to be outside of certainly the surgical arena, and then ended up also being outside of the conventional medical model. So I left in 2019, kind of started making this transition, did a fellowship through A4M, which is the American Academy of Anti-Aging Medicine. Did a fellowship there, board certification, additional hormone training, and then started my practice, Optimal Human Health. It didn't initially start out all about bone health, but very quickly, people with osteoporosis saw what I was doing and they said, oh, like a functional medicine orthopedic surgeon, like that's a good way to treat bones. And so we said, I don't know if that's true, but let's find out because it makes sense. The research supports it. And then the early evidence was so clear that we were seeing bone metabolism improve. We're seeing imaging get better. We'll go over all of that. And so we realized, oh my gosh, like this health optimization, functional integrative pathway is a way to improve bone health. And people with poor bone health, osteoporosis, osteopenia, is a huge underserved problem. So then we just shifted the practice to be all about optimal bone health, and then hormones is a big part of that. So it just kind of was all downhill from there.
Yeah, very cool. And what you said there really piqued my interest. I was cleaning up really like poor metabolic health. Like that's fascinating there. When you say metabolic health, let's just, maybe simplify that for everyone listening. What does that mean to you?
Yeah. So my subspecialty was foot and ankle, which I was excited about foot and ankle, not because I have a thing for feet. Feet are gross, but what the thing I loved about foot and ankle is that it had not been well researched. Okay. And different surgeons were doing different things for various reasons, whatever their training was, and nobody knew what the right thing was. And I'm very research oriented. So I was like, oh my gosh, let's go into foot and ankle, help to drive the research. I sat on the research committee for the Foot and Ankle Society for a decade. And, it's really hard to turn that ship around, it turns out. But what's interesting about foot and ankle is that the result of metabolic dysfunction, which the end result is diabetes, but the end result of metabolic dysfunction, or even early on, can have an impact, especially in the lower extremities. So we saw a lot of ulcers and skin breakdown and like pain and neuropathy and all these things that were really lifestyle driven. So with my interest in lifestyle and nutrition and exercise, and really what ultimately became sort of like the longevity conversation, I wanted to have these conversations with my patients, these people that are coming in with diabetes, recognizing that, look, you can actually not be diabetic if you just change the way you eat for type 2 diabetics. And that they'd never been taught that. So that's just an example of the metabolic dysfunction that we saw, insulin resistance. That's the whole spectrum of disease.
Yeah. And it's all connected, right? I guess that's kind of the important thing that people listen to. So, okay. So we're going to talk about bone health, but why don't you just explain, like, what is osteoporosis? What defines osteoporosis and osteopenia? Are they different?
Yeah. So let me just define the thing. So osteoporosis has really two definitions in my book. The accepted medical definition is based off of an imaging modality called DEXA. And so DEXA can be used to look at bone health, but can also be used to look at body composition. Generally not recommended to screen until after the age of 60, 65 for women, 70 for men, which is way too late. Another story there. But the definition is based off of this imaging modality, DEXA, which only looks at bone density. And it has to do with where you sit compared to your ethnic and sex-matched peers from early in adulthood, so at 30 years old. So it's called a T-score is the number you're looking at, and it's literally just a statistical calculation of your bone density compared to your 30-year, colleague or companion with similar ethnic and sex background. And so that T-score threshold is negative 2.5, which is, depending on the situation, usually 2.5 standard deviations. So if you know statistics, it should be a small number, but it's not. So T-score less than negative 2.5, so like negative 3, negative 3.5, that's osteoporosis. Osteopenia, which is technically not even a diagnosis, but osteopenia is between negative 1 and negative 2.5. What we're really calling that now is just low bone density, because osteopenia isn't actually a diagnosis code. So when people say, oh, I'm diagnosed with osteopenia, no, you were diagnosed with low bone density. You don't have osteoporosis yet, but maybe we should be worried about your bones. So I hope that explains what that means.
So osteopenia is sort of like on the way to osteoporosis.
Potentially, but it depends on the trajectory. So like, for example, I have osteopenia for various reasons I could talk about. But I have osteopenia, but my bone density and quality has been stable for decades. Okay. So I'm not concerned that I'm going to drift into osteoporosis because of the way that I live my life. Is it getting better? Yeah, slowly, but it's also barely under -1 to begin with.
Okay.
So it's not always a problem. And I see that too, where some women, especially, they'll get diagnosed with quote unquote osteopenia, which again is not a diagnosis. And then they're really scared because they read all these things about osteoporosis and fragility fracture and, oh my gosh, is this going to happen to me? But they don't know that they actually have a problem yet. They need more information.
Yeah.
But I wanted to say that really the diagnosis of osteoporosis should not be about T-score. That's just part of the equation. Ultimately, it's all about bone metabolism. So if you reach the point where you have osteoporosis, you have had an imbalance of bone metabolism for long enough to go from wherever you were to wherever you are. So really, it's a bone metabolism problem that has been going on for long enough that you now have this quote unquote osteoporosis, or maybe you never had good bone density in the first place. And that's what I really want to get across to your audience today, is how to know that and then maintain or improve that earlier in adult life instead of waiting until your 60s and 70s.
I feel like I'm going to open a can of worms here, but when you say bone metabolism,
Yeah, sure.
Yeah. Is that the same as bone density? Like, what is bone metabolism?
Yes. Great question. It's like a small can of worms. So
Okay.
when we look at bones, like bone, people think of bones as like, oh, it's my skeleton, it's my structure. And yes, that's true, but they are living organs. So bones are doing a lot. There's bone marrow in there. They make stem cells. They're making blood. They're making all these things. To maintain the structure, that's kind of like the roads that we're used to driving on, where like a road breaks down over time. So you have to rebuild roads. We're always rebuilding bridges and roads. Like you have to continue to rebuild the structure, the infrastructure. Same thing in our bodies. So you actually redo, like your body will recreate your entire skeleton about every decade.
Wow.
So the femur that you have now is not the femur you had 10 years. It's a totally different organ than it was 10 years ago. So we're always breaking down and we're always building up bone. And there are so many different inputs which will dictate which we're doing more of. And that's why if you have osteoporosis, you've just been breaking down more than you've been building up for too long.
Okay. That helps. That helps explain it for sure. So I always want to try to bring this into, so now we know what osteoporosis and osteopenia are. What are we seeing for women in 35 to 55? So all my sisters who are listening to this right now, what are we seeing for them with these two?
Yeah.
Mm-hmm.
The scary thing is we don't know. So I have patients in their 30s, 40s, and 50s for sure, and they got screened for whatever reason, usually because they've had a fracture, and somebody looked at their fracture, they're like, oh, that's weird that you had this fracture. Let's get a DEXA. They get a DEXA and they have osteoporosis, and they had no idea. So I think it's usually predictable if you think about risk factors, but nobody is screening young adults. And I'm on a mission to change that. And I've got some companies that I'm working with that want to put different imaging modalities in front of all young adults, both women and men, because I think that we actually have an epidemic of osteoporosis and osteopenia in our young adult population, and we don't know it. So that's the biggest issue, is that we don't know. Women don't know what their bone density is unless they're testing, and nobody's testing.
Right, because it's almost quote unquote too young. Like
it's too young. Well, and if you ask your insurance company, they'll tell you it's too young. They'll say we don't screen until 65. But think about that for a second. We know that some of the biggest inputs for bone health are hormones. Mm-hmm. Women on average go through menopause at 50, 51, right?
Yeah.
Why would you wait 15 years knowing that women are going to lose, that's going to like rapidly accelerate bone loss? And if you don't know your starting point, you don't know that that's a problem or not.
The same goes in like hormonal health specifically. It's like we know the hormones are going to reach a low level. So why are we waiting to that point to understand what our good levels feel like and look like? It's this looking at more functional prevention as opposed to waiting until there's a problem that needs to be fixed.
Totally. And I think there's a huge opportunity in women like premenopause, even like perimenopause, certainly premenopause, before even that time frame, because when you look at if you look at symptoms of cycling and dysfunctional cycling, dysfunctional ovulation, like those are all things that are going to have an impact on bones. We're not having that conversation. Right. So, for example, if a woman's not ovulating, she's not getting a luteal surge of progesterone, right? Like we need this push-pull between estrogen and progesterone in order to maintain our bone. We know that if a woman is not having 5 quote-unquote normal cycles, whatever that means, but if you're not having at least 5, then you're losing bone. And that's with normal estrogen levels. So the push-pull, estrogen and progesterone both have an impact on bone. And we need to be, again, having this conversation for women in their 20s, 30s, and 40s, not waiting until it goes away in their 50s.
Right. Because what's the fear? If we have, I mean, I think, as a generic understanding, like the fear is we're going to break things and not be able to heal properly. Like, is that kind of the doom and gloom that we think about if we get osteoporosis?
Yeah. I look at it like this. I treated a lot of hip fractures, and hip fracture is the thing that I fear the most. So a hip fracture has a terrible morbidity, meaning if you have a hip fracture, the likelihood of you having a good outcome is really low. So if you just look at those statistics, a third of patients after a hip fracture die within 12 months. A third lose independence completely, and a third regain independence, but they're usually not the same. So this generally, of course, is happening in older individuals, but to prevent that hip fracture in your, say, 50s and 60s, you need to start in your 40s and 30s. And so this is a decades problem, and our human brains aren't wired well for long-term risk. So I can't even talk to women in their 30s about a hip fracture because it's too far away.
Right.
They're not going to change their daily habits based off of this risk 30 years from now. So we need to look at it a different way. So now I look at it like this. So bone health or bones give us great feedback. So we have biomarkers to understand what's happening with that bone metabolism that I discussed. We have imaging that can tell us how dense it is. There's newer imaging that can tell us what our bone quality is like. So here's the thing. This is the biggest key. If we monitor our bone health throughout our adult life, if we're losing bone, something's wrong. Mm-hmm. Right? If we're losing bone as an adult, something's wrong. We have proven in our practice that we can build bone even in women 60, 70, 80 years old. Mm-hmm. So if we can do that all through lifestyle, we don't need to accept that bone loss is a part of aging. So then I think we should be looking at bone health as a biomarker of health span. Yeah. If you're losing bone, something's wrong. It could be hormonal, it could be diet, it could be gut, it could be a lot of things. But we don't know because it's like on the dashboard of your car. Like this is a light popping up on the dashboard of your car. Like check engine, you're losing bone, something's wrong. So even though that long-term risk isn't real, if you're not feeling your best, mm-hmm. bone might be able to give you some indication of what's going on, and then you can look deeper down the right rabbit hole. Right. But outside of that, young adults aren't going to really be concerned about that long-term risk.
Right. No, I get that. Okay, so is it fair to say then that because our hormones are shifting in perimenopause and menopause, it becomes, a faster problem or a quicker problem? And that's why, obviously we want to cure earlier. Okay. So if that's the case, then how do we, what are some things we can be doing lifestyle wise, I guess, to impact the hormones, to impact the bones, or to bypass the hormones and just impact the bones? Obviously both of those things are coming into play. Because if you're not doing the things you need to do lifestyle wise to have supported hormones, that's going to impact our bones, if I understand what you're saying.
Correct.
And then obviously there's lifestyle things that are going to directly impact. So yeah. Sorry, you go.
Yeah. So I think, the information that you're giving your audience is great, because for women that are having, this is not always true, but this is often true, for women that are having dysfunctional cycles, mm-hmm. PMDD, pain, mood, all those things, there is sometimes an underlying hormonal imbalance that can be addressed one way or another. Yeah. So the fact that you're helping women to understand that, hey, this is not normal and there's something you can do about it, that all of that information is going to impact your bones in a positive way. So you're already doing it. So then the other things that I think are very helpful is to look at from a dietary perspective, what's most important, because we all have our beliefs around diet. But from a dietary perspective, what's most important? From an exercise perspective, what's most valuable for your bones and your muscles? And then also some other things that you might want to be doing, and I can talk about those. Yeah. Do you want me to run through those three?
Talk about those, because I think, I think you have everyone's ears for sure. I mean, I feel already more bought in, I need to be aware of my bone density. I mean, I think I was already starting to hear it, but I'm 43. So it's I'm more hearing it from my mom, right? Who's late 60s. So, I want to hear, what do we do? Okay, I'm here, bought in. What do I do?
Right. So, okay, first thing is I would get screened. And so the device that I like to get screened is a device from a company called Echolight, and it's called REMS. And REMS is an acronym, but REMS. And it's an ultrasound device. So the same ultrasound device that you would use if you were going to your GYN and they're looking at, whatever in your pelvis. Same looking thing, but different algorithm behind it that can look at your bones. So you can get density and quality. Now, they're not globally available. Insurance doesn't cover them, but they are becoming more and more available. And again, I'm working with companies to help bring that forward. That's the best device, in my opinion. If you don't have that and you have to get a DEXA, at least you can get a DEXA and it gives you something, because you could know at least, is your T-score -3 or -1? Like, it's good to know. So know what your bone density is out of the gate. And then from a lifestyle perspective, most important thing, hands down, is diet. So what I tell our patients, because I was just on stage last weekend talking about this, and we have such an interesting audience for those with osteoporosis because we have a lot of extremes. So there's always, every audience I speak to, there's like a carnivore crowd and there's like a vegan crowd, and then there's everybody in between. And so I have to find some way to get across the big picture without offending people and having them walk out. So what I've decided, this is the way I need to frame it, which is I'm not here to change your beliefs. Because in such a polarized society, and nutrition is no different, in such a polarized society, if you're deciding that you're going to eat something, it becomes a belief system. And I'm not here to change your belief system. But regardless of your belief system, we need to focus on protein intake and adequate calories. And I see this so frequently, especially in this 30 to 4-year-old woman age group, because everybody's trying to be super lean and everybody's trying to have the Instagram lifestyle. Calorie reduction will not get you there for most people. And if because we see this in patients that are coming in, they're under eating and they're not getting adequate protein. And that is just a clear recipe for losing muscle and bone. So regardless of your beliefs around food, we need to focus on protein. My beliefs are that it needs to come from animal sources to be the most efficient. So animal protein forward, if you're okay with that. And getting enough protein, around 1 gram per pound of ideal body weight, is a good starting point. Some women even need more than that because of gut dysfunction. And then after that, once you optimize that, then everything else can be whatever, right? So you want to eat a low inflammation, good for your metabolism, whatever, but it's going to be different for everybody.
Yeah, and so, how they feel. Yeah, what makes them feel good.
Well, and what makes you feel good? Like, what is your genetics like? What's your ethnic background like? Like, if I said nobody should ever eat beans, right? Like, my entire Latin America population would be like, no, never. Like, I can't not eat beans, but I don't eat beans, but I don't like beans, So it's just I don't want to be that dogmatic and strict around it, because sure, you can eat beans, just prepare them the right way and know if they hurt your gut. Yeah. So I don't like to be that dogmatic. And what I find is that if you optimize protein, the vast majority of people, everything else falls into line.
Yeah. 1 gram per pound of body weight is your recommendation.
Of ideal body weight is a good starting point.
Sorry, that's a very important definition, isn't it?
It really is, because for overweight people, that 1 gram per pound would overshoot it. But I have a lot of underweight patients too. Right. So I have, my 4'11", 95 pound woman needs more than 95 grams of protein.
Right. Yeah. And I'm sure that's challenging. Why? I just have to bring this in because I always think I agree with you. When it comes to our hormones, a lot comes down to nutrition. Most comes down, and it's so within our control. Sleep is a beautiful energy source, not always within our control. But nutrition is what we choose to put in and out. Why do you think it's so hard for people?
Well, a lot of reasons. Number one, our brains are wired to pursue joy and happiness, and we do that through food. And some of that's cultural, some of it's personal, some of it's genetic, behavioral. But we are always seeking something that is giving us a dopamine hit. We're always seeking something that tastes good because we're wired to survive. But in our overabundant society, surviving is different. Yeah. So then you have to start getting really cerebral about your food decision making. And then there's all of the noise, of course, from people telling you what you should and shouldn't eat. But then also our food supply sucks. Yeah. So toxic food supply, ultra processed foods, you have to be so conscious about every single thing that goes in your mouth.
Yeah.
that it's really hard, and my wife actually works in the weight loss space. So she has her own company and is helping thousands of people to lose weight, but I'm generally helping my patients to gain weight.
Right.
And it's for like the underlying reasons are the same, but different people, different situation. So it's a really complex thing that requires, again, for me, it requires so much thought, even personally. Like I track food a lot. I haven't for the last few months, but I mean, for years, everything I ate, I tracked, because otherwise I would overeat. Things would slip in. Like, it's amazing. In order for me to stay on track, I have to track to get rid of the confusion, to get rid of the extra bite here or there. Like, oh, I feel bad throwing away my kids' macaroni and cheese, like it's hard. It's really hard.
Yeah, it is challenging. Okay, thank you. I just like hearing other people's opinions on that. And I think just the normalization and the validation. So people are like, listen, it's not you. It's hard for everyone.
It's hard for everyone. And if it's not hard for someone, they're either lying or they just are genetically like super gifted.
Right.
It's just a thing, right? They're like, I don't know, I don't get hungry, Like,
I know.
I'm never hungry. I'm always full. And I only make good food choices, like, I don't know. I guess that happens.
No, right. Okay,
yeah.
So priority one, we know so much comes from
food.
nutrition. We want to prioritize eating enough and eating enough protein specifically, regardless of what your dietary beliefs are. That's critical for the bone. What else?
And then there's the activity side. So I find this is changing, thankfully, but in a lot of our patients who are, 50s and 60s, they've lived their entire adult life as women afraid to lift anything because they're going to get, quote unquote, too big, right? Hear this all the time. And I just, I can't shout this loud enough that I've never had a patient ever who started lifting weights that got too big.
Yeah.
Ever.
I've been lifting weight for years and I have a hard time putting on muscle. So I totally vouch.
It's hard. If getting super muscular were easy, like you'd see a lot of really fit people walking around. Like, it's hard to put on muscle. And when you see women that are really muscular, A, there's a huge genetic component to that, but B, they're working really, really hard at that, and usually using some tools that you wouldn't use. Yeah. So we have to do resistance training to maintain muscle mass, no question. But then also doing things that are going to provoke impact in our bones. And this is totally absent in our society because we don't have to jump off of trees and run through the woods. And we don't have to live like our ancestors did. We never do impact ever, right? We have escalators. People don't even walk up and down stairs anymore. And so we're never hitting anything harder than what is generally going to be sustained if you're just standing. So our skeletons aren't adjusting for that anymore. If you think about kids, go back to, of course, go back a couple of decades. So now you have less screens. Kids are always running around. You think of a toddler. I don't know if you have kids, but how loud a toddler walks, right? It sounds like they have moon boots on. They're just and that's their body training them to do impact. They don't have to walk that hard. They have muscular control. That's their body's doing impact intentionally. And kids run and jump, fall off stuff, and they're impacting all the time, right? Gymnasts have the best bone of any athlete, despite potential eating disorders. It's all because of the literal impact. So we need some way to put that into our life as an adult. And it could be intentional, HIIT training, box jumps, burpees. You can do a lot of things, but we need to have some kind of impact and high velocity stuff in your workouts if you can. Not everybody can, but if you can, it really helps.
Interesting. So the resistance training and the impact as well.
Yeah. I think you have to have both. And I just had a patient who she's like, I don't do impact and my bone got better. I was like, well, okay. Maybe it's not everybody, but it's most people. We need to stimulate that bone.
Yeah. And walking is not going to do it.
Walking is not impact. Let's do this. The term weight-bearing exercise, let's just call it stupid. It is a stupid term because if you're standing up, you're weight-bearing, right? So let's stop talking about weight-bearing exercise as a tool for bone health. No, everything is weight-bearing, assuming you're standing on your feet. So let's just eliminate that term. We need resistance training and we need impact. Walking is not impact. Running is not impact. In fact, runners have low bone density. So running is not impact. We need more than 4 multiples of body weight, which you can get through acceleration, in order to stimulate bone. So you're not going to resistance train your way into improving your bone health. You need impact.
Right. So with impact, let's give some examples here. I know you mentioned kind of some HIIT training. You mentioned box jumps.
Yeah.
The other things I'm thinking, like if you're looking at a workout program and you want to make sure it has this impact, some other moves might be.
Yeah. So some very bone health specific stuff. So actually, we're in the process of creating this new workout program to help people who really never, especially women, never lifted a weight. How do you teach somebody who's never lifted a weight to get to the point where you can do, say, like, a barbell back squat, right? Or overhead press, right? Like, how do you get somebody there? And then in that, let's do some impact. So the easiest impact exercise to do is a simple heel drop, standing on your feet, preferably barefoot on a hard surface, but most people will start with shoes on. Just rise up onto your toes and let yourself down. It's amazing how much force you can generate by doing that.
Interesting. And
yeah,
that
it's amazing.
Will help. Does
that alone
help the bone metabolism? Is that what's
so?
happening?
Yeah, so it's amazing, and they learned this. Like early researchers learned this. In fact, one of the things we learn as an orthopedic surgeon is this law called Wolff's law, which essentially just says that the bone responds to the stresses which it's put under. But if you do impact, and we saw this in the early research for workers that were like jumping out of things, they had less injuries and fractures than those that didn't. So like field workers versus those that were doing this other type of work. And so they realized like, oh, well, like jumping out of this wagon or whatever it was at the time, that like whatever 3 feet was having some kind of a literal impact on their skeleton. Mm-hmm. And so we know now, based on the true science, that you need, again, 4 multiples of body weight or 3 to 5 Gs. This is, again, gets like, physics gets challenging here, but that's G's is acceleration. So 3 to 5 G's, which if you measure acceleration in walking, you go from 0.8 to 1.2. It's just not enough. So we need that stimulus in order for the bones to really literally tell the osteoblast to start laying down more bone. Because outside of that resistance training, your muscles are pulling on the bone, but it's very static. Unless you're doing something intentionally dynamic, which there is evidence to support, except that it's a really terrible place to start. Like if you don't know how to lift weights, please don't do high velocity resistance training. Like that's a recipe for injury. So impact and resistance training, great combo.
Okay. And I can hear people already asking me like, how many days a week, Dr.
Yeah. So the good news is bone has been actually relatively well studied. So there's studies literally looking at the intervention of heel drops, and the protocols were somewhere between 50 and 100 heel drops, which is a lot, but 50 and 100 heel drops 5 days a week.
Oh, wow.
So I guess you get the weekends off. Now, work up to this though, because if you just do it one time barefoot and you'll realize like, oh wow, like this is a lot of force. So if you have achy joints, if you have osteoarthritis, like ease into this, maybe even ask your doctor because you could actually generate a fracture if you had really low bone density. Like you could actually fracture your spine if you were to do that hard enough. So be careful, but that just shows you how powerful it is.
Yeah, that's interesting. Okay. This is really, really awesome. So I feel like, okay, we know we need to start caring as women. We know it's going to get more challenging with the shifting of our hormone. And you know what? Maybe we should talk about this for just a minute. Like, how do our hormones, like, as you say, estrogen, progesterone, testosterone, how do these play a role as they decline in our bone density?
Yeah, this is huge. So I actually just we have this like health optimization pyramid that kind of has all the different pieces like exercise and nutrition and stuff. And I used to have like the lifestyle pillars underneath, sleep, mindset. And then I had like biomarker driven supplementation and then hormone optimization and then peptides and then pharmaceuticals. And so I had this kind of like ladder of treatment. I recently just shifted it because what we're finding in our patients is that hormones are so powerful. That we can't improve, especially in postmenopausal women, because some women are they're not candidates, not interested. They're 20 plus years out from menopause. And so we can still do the same lifestyle stuff. And we do see improvement in bone health. It's just so much slower.
Yeah.
If I can optimize a woman's hormones, even like perimenopause, looking at progesterone levels and testosterone, in postmenopause, certainly using the right biomarkers, if you optimize hormones, you'll see 10% improvement year after year.
Oh, wow.
It's that powerful. So yeah, all the other stuff matters too, but hormones are one of the biggest levers you can pull, which then leads to the question of, well, like, what conversation should we really be having with women as they go through menopause?
Yeah.
Right. And it's totally different. So I was just scripting for some videos and I was reading a recent article that was published in The Lancet about this, the fact that we need to change our conversation around when to start hormones. And not only should we be having this conversation with older women, 60s and 70s, we should absolutely be having that risk-benefit conversation with them. But the conversation for the women in the young 50s where maybe it's an option, but if you look statistically, 4% of women over the age of 50 who could be on HRT are on HRT. 4.
Oh, I know. That's wild.
So clearly this conversation is not being had in a meaningful way with the vast majority of women.
It absolutely is not. And I'm Canadian originally, so I work with a lot of Canadians as well. And there's just no conversation happening. I can't speak for all the areas, but it's just shocking to me that how little we know about our own bodies as women, how little we know about these hormones that play such a massive impact in our life.
Mm-hmm.
And what I love are some of these tips you've already given us, and I should give you some space to round those out if you have some more. Sorry, but these foundational pieces of the activity, like of the daily activity that we do, of the way we eat, this is what allows our body to even absorb, be prepared for accepting these hormones, should that be the move for us to make. So it's
absolutely.
It all kind of comes down to you cannot avoid these things, can we? Can't say it in any other language.
No, you can't. No. Yeah. And that's, I love pointing that out too, because, I love hormone replacement. I love hormone optimization, but alone, when you look at the research, it's not a powerful tool when you look at it as an isolated intervention. So if you take somebody who has a terrible lifestyle and give them progesterone, are they going to get profoundly better? No, not really. Mm-hmm. Right. And so if you give it to the right person at the right time in combination with other lifestyle factors, then yeah, it can absolutely be profound. So it's just I look at it as an amplifier of lifestyle or a detractor of lifestyle, but lifestyle's got to be in there. And that's why even that pyramid, the foundations are still there. Exercise, nutrition, I said switch those around. Nutrition, exercise, sleep, and mindset. You have to have all 4 of those at least somewhat in check for anything else to matter.
I totally agree. It's just the kindergarten basics of what we must do in order to thrive. We see animals do it all the time, that are just not so busy up between the ears, right? So,
right.
So do you have a specific recommend? Are there more, when we talk about those other foundations of stress management and sleep, do you have specific recommendations there as a part of these foundations?
Yes. So let's start with sleep. So sleep is, it's critical. But as you said, we don't all have great authority over how we sleep, right? There's genetic components, there's environmental factors, there's a lot of factors with sleep. But optimizing it to the best of your ability is critical. And some of the basic, just fundamental lifestyle stuff that people forget is just focusing on having an absolutely protected sleep window. Mm-hmm. And this is the easiest thing. And it's so hard with children, especially my kids are 12, 11, and 6. So my 12-year-old is going on 18. So he doesn't go to bed until late. But my 6-year-old, she sleeps great, but she's still will wake up. Last night she was coughing all night long. Right. So there's all of these different factors. Yeah. But having that just so critical, have that window. My kids know I'm in my bedroom by 9:30.
Yeah.
I'm asleep by 10. Yeah. Do not come get me unless something is bleeding or there's somebody in the house that doesn't belong there. Emergencies only, right? Daddy's asleep at 10 and I do not get up before 6, no matter how much is on my plate, no matter how busy I am. I keep that 8-hour window. And I know for me, that gets me at least 7 hours of sleep because I've tracked my sleep for years. So for me, that's great. Now, my wife, for example, she needs more. It's not because she's a woman. It's because of how she's wired, right? She just needs more sleep. She probably needs, honestly, a 10-hour window, but she gives herself a 9-hour window, and that gets her 8+ hours of sleep. Right. And when we have to be strict about that, if you do that one thing, then most people are going to have significantly better sleep.
And I totally agree with you. I'm the exact same. I have a very similar sleep window to you. And I think it makes, when we were talking about the difficulties of nutrition, it makes those decisions, it just literally makes everything easier if we can just create the space for sleep.
Mm-hmm. Yeah,
trying to control
absolutely.
Squeezing water in your hands. Okay, it's a really great tip. Just being rigorous and committed to your window and the consistency there.
Yep, absolutely.
And what about stress management?
Mindset is one of the hardest things to deal with.
It is.
Because we're all busy.
Yes.
So I'm actually right now I'm going through, do you know who Joe Dispenza is?
Yes, of course.
Yeah. Okay. Well, not everybody knows, but anyway, so
we're in the same.
If you've been there, you know what I'm talking about. So Joe Dispenza, for those who don't know who Joe is, he's a chiropractor who got into the space of meditation and has created this movement that is just, it's surreal. I mean, it's even if you don't believe in what he's talking about, it's still cool to see. And his retreats are amazing, sell out within hours of becoming available. Thousands of people meditating together for, days on end. It's really cool. But I'm going through this medical training they have for providers called NCS, or Neuro Change Solutions. And I think this is going to be a really cool way for people to help with the mindset thing. Because what I see is that, especially in the bone health space, there's so much fear, there's so much anxiety, and it is a downward spiral, especially once you have the diagnosis of osteoporosis. We're all so busy, we're all overwhelmed. So many women have dysfunctional adrenals, or whatever you want to call that. Cortisol dysregulation, immune dysfunction as a result. Like, all those things are negative, but the way that we view it in our mind can have such an impact on how we view our day, which then can have an impact on the thoughts that we have, the behaviors that we make, which then leads to the emotions that we experience, which then feeds back to those thoughts. And so I love this idea, and I look forward to putting this in front of our patients, because it's so easy to say, like, reduce your stress. Well, but like, if you're caring for like a sick parent or a sick kid, or you have a stressful job, like, you don't have control over so many things. So really, it's an inside game. Yeah. And we need to come up with, okay, how do I live within this environment? You can change your environment too, but how do I live within the environment that I have? Because so many of the things that we are experiencing are not within our control.
Yeah. I love that you said that. I had, I think it is, as you say, when you go through stressful times in life, it plays such a massive role in our health. Like, even if you are doing the things, it will break you down. It will impact those.
Absolutely.
Hormones are going to impact those. So I love that reminder. And Joe Dispenza is a great tip for anyone listening. You're right, to go and start recognizing like how we just shift the thought patterns that we have a little bit.
Yeah. And you don't have to meditate like Joe. Like, Joe's all for people spending, an hour, 2 hours meditating, which is amazing. And if that's something you can do in your life, then kudos to you. I recommend you do it. I can't do that. But for me, even 10 minutes with the right shift in my mind, like, I'm also doing heart-brain coherence, heart math work. Just those, like, that little bit of breath work, heart math, heart-brain coherence, it just recalibrates me.
Yeah.
So then no matter what's happening, sick kids, aging parents, business stuff, like, all of it just becomes less important. Not that we don't take care of it. It's just not an emergency.
Yeah. Yeah. I love that. That's an amazing tip. Dr. Doug, this has been just like so fast. I really appreciate it. You've just made it. I feel like we've taken us on this journey where it's like, okay, why do we need to care about this? Why do we need to care about this now? And what are the simple things that we can do? Because that is enough, I think, for women in 35 to 55 when we're already overwhelmed. Like, if you just take these 4 things and you nail these 4 things, that's enough.
It's enough.
Yeah.
Right.
So I love
and it's enough to focus on.
Yes, it's still enough. Pick one until you're comfortable with it. Is there anything else you feel like, before we tell everyone where they can find you, anything else that you think women should know about this important part of their health?
Yeah, I mean, I think just for women's health overall, we are in what I've heard called a renaissance of women's health. I don't know that I agree with that term necessarily. I think there's better exposure of the discrepancy between our healthcare system for women and men. I think that's probably true. But women are at risk of not being heard, of being dismissed, of not being offered options. So especially for women, you have to be an advocate for your health, and you have to do the research on your own, be proactive, know what you need, or at least what you think you need, so that you can ask the right questions. If you're not driving it, the healthcare system will not take care of you, especially as a woman. You have to drive it. You have to know what you need and what you want. And maybe you're wrong. Maybe your doctor can help steer you, because let's face it, we're all in a biased social world. But at least you can go in armed with some information to have that conversation. Otherwise, your doctor's in a rush. Even if they love you, your doctor's in a rush. They're behind already. They have 5 minutes to see you and chart and prescribe the next drug and move on. That's just the system as it's built. It's not wrong. I would even argue it's not broken. It is doing exactly what it's designed to do. It's just not what we want it to do. Right. And especially as a woman, you have to fight for yourself and be educated going into those visits.
I love that. That's such a great kind of finishing piece of advice. And for the women listening who might feel uncomfortable with that or overwhelmed by that, I feel like following you and checking out, someone like Dr. Doug is going to help you gain those skills, give you that direction, give you that knowledge, so you don't have to feel like you need to go down a rabbit hole on Google on your own. So thank you.
It's endless.
It is endless, right? It is. So for the women listening who, I really encourage you to go and follow the Dr. Doug show and follow Dr. Doug on Instagram. Got some really amazing tips there, but where do they go? How do they learn more from you?
Yeah. So if you have osteoporosis, then going to the Dr. Doug show on YouTube is a great place to start. We have, I think at last check, like 200 and something videos. We're creating 3 to 4 videos every week. It is our mission to get this information out there, and there's so much information. I have a list of topics for like infinitely long to produce for this show. So it's a really great place if you have osteoporosis. So YouTube, the Dr. Doug Show. Instagram, we repurpose a lot of that information, put it on Instagram. So if you're an Instagram person, that's great. That flows through to Facebook as well. Same handle, Dr. Doug Lucas. And then if you actually want to ask questions, if you want to get engaged in a community of people that are actually looking to improve their bone health, asking all the questions about supplement and lifestyle and research and modalities and all the stuff, then the Osteo Collective is our community. And the Osteo Collective, we call it TOC. It's osteocollective.com. It is a low-cost community. We do a live weekly Q&A, or we have topic-driven Q&A. It's usually attended by, like a third of the people who are in the community. We do it live once a week, and then you can watch it after. We have content. Again, the community asking questions. We have resources in there from a nutrition and dietary perspective. So it is the place to DIY bone health, and that's where I'm probably going to be spending most of my professional time, is actually optimizing that, because that's a global platform that is going to help people. We say there's 10 million people in the US with osteoporosis. There's 200 million worldwide. And there is no system, there's no healthcare system that manages this appropriately. So we now have a global perspective on what the mission is when it comes to bone health.
Amazing. I will put all of those links in the show notes for everyone. Dr. Doug, thank you so much for being here today and for sharing your amazing knowledge in such a simple way and such a digestible way. I really appreciate the work that you do.
Awesome. Thank you so much. I appreciate it.
Thank you. All right, sisters. I think you got some really great information here today. So go out, be more in your life and not just less on a scale. And we'll catch you in the next episode.
Thank you so much for joining me on the Period Whisperer podcast. If you liked this episode, take 30 seconds right now to write a review on iTunes, and then reach out to me directly on Instagram at Bria_period_whisperer and message me there with a screenshot of your review. As a thank you, I will give you a customized free hormone audit to get you on your way to the best health of your life in midlife.